Hi, my name is Dr. Stefanie Schultis, and I am a board-certified gynecologist in private practice close to New Orleans for over 30 years. It has been my pleasure to help many women with issues that range from just bothersome to life-altering. Today, I'd like to tell you about a new, innovative, and effective treatment for urinary incontinence and vaginal regeneration. Urinary incontinence and vaginal changes such as laxity and loss of tone can lead to a decrease in sexual pleasure and responsiveness. These problems can arise from aging, the after effects of pregnancy, hormonal and metabolic changes, and just plain life. I myself have suffered with all of these. Many women have changes of the vagina that lead to pain with intercourse, including tearing, bleeding, inability to have penetration, even with lubricant, to the point of avoiding situations of intimacy. These issues can lead to unnecessary guilt, poor communication, and can be devastating to relationships. Urinary incontinence affects as many as 1 in 4 women over the age of 18. Many have to literally alter their lives due to urinary loss, frequency, and urgency. Wearing a pad and avoiding certain situations. Many people feel embarrassed about thinking people can detect an odor. Others will have rawness of the vulva due to the wetness and chronic urinary and vaginal infections. Some sleep disturbances due to frequency and even needing to leave meetings, get out of line at the grocery, and other frustrating times when it feels like our bladder runs our life. Another serious condition, not to be forgotten, is a debilitating vulvar skin condition that leads to severe itching and pain called lichen sclerosus. A very important point to make at this time is that many suffer in silence, thinking they are abnormal. They are too embarrassed to talk about it and think there probably isn't anything that can help them. I have learned to ask my patients if they have any of these issues. The Juliet Laser is a non-surgical, in-office, short, minimally painful procedure to treat vaginal atrophy, laxity, urinary incontinence, and frequency of urination. This laser has been the most popular for feminine issues with 5 million procedures performed worldwide, with the next closest only reaching 56,000 procedures as of this date. This Juliet laser technology works by causing micro damage to the vaginal tissues with ablative and thermal energy, which causes the body to heal itself, so to speak, and create new collagen, elastin, and regenerate the tissues to close to their previous natural, youthful condition. These regenerated tissues lead to strengthening of the bladder neck and return of the suppleness and tone of the vagina. Many still need to use lubricants. By the way, a good tip for this is coconut oil. It is safe and fun for you and him, but the use of hormone creams is often no longer needed. The Juliet Laser has 2 handles, one for the internal vaginal therapy and one for the vulvar or external treatments. Some women desire to improve the tone, texture, and pigmentation to the vulva, and others may like to reduce the size of their labia, and the external treatments can assist with these issues. Very importantly to know that many women suffer with the autoimmune condition lichen sclerosus. There is ongoing research that shows that the Juliet external treatments, as well as PRP therapies, which we also perform, may be helpful with this condition. The internal treatment may last 10 to 15 minutes and is generally painless. The external also may last approximately 10 minutes, but does require an anesthetic cream. A post-procedure balm is then used to help the vulva heal. There will be a mild sunburn feeling for a few days after the external treatment, and only a bit of discharge noted from the internal treatment. Another great advantage of the new laser treatments is that there is really no downtime. You walk in, you walk out. The procedures can be done together or separately. Initially, they are repeated in 4 weeks, and possibly in difficult situations again in another 4 weeks. Most of the time, however, 2 treatments are adequate. Then an annual one-time maintenance treatment is recommended. But do remember, everyone's situation is individualized and recommendations for them may be different. In addition to the Juliet Laser, I also offer platelet-rich plasma treatments, known as PRP, and the O-Shot, that is an option for urinary incontinence and vaginal issues. In a consultation, you and I can determine what procedure may be right for you. So if you or someone you know suffers with any or all of these conditions, I would love to help. I am really so excited to be able to offer these new effective therapies. Please call my office in Covington for a consultation at 985-898-1940 and visit my website at Stefanie, Stefanie, Schultis, SCHULTIS, MD.com for much more information. And thank you.